All right, gather around. We got some shit to talk about. You ever looked into something and then the further and further you get into it, you just become more and more infuriated? That's exactly what happened here. Today, we're going to talk about healthcare and the healthcare industry. Yeah, this gets worse. So healthcare as we know it really didn't come around until World War II. And that's because during World War II, the US government stepped in and said, we're going to control the wages of employees. And this really became big because the War Labor Board decided that fringe benefits such as health insurance and sick leave wasn't considered part of the wages for the wage control. So then to attract new employees, because they couldn't pay anybody anymore because the government stepped in and was here to help, employers added the fringe benefits such as sick leave, vacation, and healthcare. Healthcare being the biggest one. So because of the increase in this, President Harry S. Truman went, well, you know what would be a good idea is if we had a government health program in which people could buy into. It's completely optional. They're not required to do it. But he envisioned a nationalized system that was optional and available to all Americans. You see, as part of this, the government would pay any cost for services rendered for any doctor who decided to be part of the program. See, there was also an added benefit. You see, the insurance policy would pay cash to the policyholder in the event of an illness or injury. This would be to cover lost wages. Yeah, I'm going to keep doing that today. Now, this plan was widely popular with the public. I mean, they fucking love the idea. However, the Chamber of Commerce, the American Hospital Association, and the AMA were all against it. Gee, I wonder why. They denounced the plan and called it socialism. You see, now everything chugged along for a while until 2010. Specifically, March 23rd, 2010. This is when the Affordable Care Act was passed. You see, healthcare was a self-regulated market. There were plans that cost $2,000-$3,000, and there were plans that cost $200-$300 if you weren't unemployer-sponsored. See, the thing is, the healthcare company could deny you. So the plans were regulated. Because if you had multiple comorbidities, that's diseases that play off of each other, like COVID and pneumonia, they would deny you access to the plan. Now, some people thought, oh, this is just not wanting to pay out benefits. No, really is regulation. See, this is how they kept costs low. The more money the insurance company pays out, the more money they have to ask for. And I am not saying health insurance companies are the greatest thing under the sun. They're not. The two most evil industries are the food industry and health insurance. However, what this did do was regulate the market. You see, people who couldn't afford the $2,000 plan didn't get the $2,000 plan. Or if they couldn't get insurance at all, they found other options. This is where Medicare and Medicaid came in. However, people that could afford it could pay for it. And you'd get great coverage. People could pay $200-$300 a month and have amazing coverage. That's because the market was regulated. That was until 2010. See, the Affordable Care Act not only provided a government subsidy to lower the cost, but it required health insurance companies to take on people. They couldn't deny them. So people who have comorbidities and lots of diseases and requiring lots of medication, magically were getting on these amazing health plans that paid for everything, which means the insurance company had to pay for everything, which means cost went up. You see, self-regulating market. As demand goes up, costs go up. As demand comes down, costs go down. That's the beauty of a self-regulating market. To which Obama fucked the whole thing up. Thanks, Obama. You see, now we're stuck with a whole bunch of plans with people who are requiring the insurance companies to pay a ton of money. So the cost goes up. And the insurance companies are getting additional government subsidies. Well, we can charge $4,000 for a health plan now because the government's going to give us $3,200 of it. That's capitalism. So there's a whole cycle of money from one to the other where the government gives subsidies to the insurance company and the insurance company pays it back and then we pay into it. And there's a whole loop around it that is simply too confusing. Well, it's not confusing. I just don't have enough time on here. But Google it. It's amazing. And the Affordable Care Act was okay for a while. Then COVID hit. And people were going to the doctor a lot more, requiring more medication. See, that was a big boom in telehealth. People didn't even need to go to the doctor anymore. They can just FaceTime right there. This led to a lot of other problems in the healthcare industry, like medication shortages. Medications like Adderall. They've been on a shortage since COVID. And that's because people didn't need to go through the steps to get diagnosed with ADHD to get Adderall. They just did a telehealth appointment. And the insurance companies then covered the cost. And then doctors started peddling off Adderall left and right because people were depressed and showing symptoms because they were stuck in the house in COVID. So now you have an entire market of people who really don't need Adderall, making it hard for the people who actually have the diagnosis and need the Adderall to get it. This is why health insurance companies are requiring a ton of prior authorizations on medications now, because they want to know that this patient actually needs this medication. And it's not for the benefit of the people. It's because this medication is costing them a ton of money. See, everybody's bitching about claims being denied. The Affordable Care Act pretty much created that. Thanks, Obama. This whole thing just fucking infuriated me. And with that being said, thanks for watching. The best way to support me is to like, comment, or share on these videos. As requested, Spring Break 1776 t-shirts and Paul Revere's Pub Crawl t-shirts are up. The link is in my bio. And I'll be doing a live tonight, right around 9 p.m. And episode 4 of By the People will be up this evening, a little bit after 10. And with that being said, be nice, be kind, be patient.